specialized in skin diseases. We were founded in 1908 in Denmark and have a very rich history, obviously. And as part of that history, Fucidin plays a key role. We are privileged in the sense that we are 100% owned by a foundation.
Wow.
So we have no external shareholders, but all the profit that are made in the company is reinvested in order to provide better solutions for patients.
Awesome. Okay.
It actually makes it very motivating working for the company. I myself joined 25 years ago. It was a coincidence. I just needed a job. But it's not a coincidence I've stayed. I mean, the fact that in Leo we are not accountable to shareholders but to patients only is a very strong motivation.
And in 25 years, to reach where you are, it's pretty amazing.
Yeah, well, I've been very fortunate. Actually, I just celebrated my 25 years anniversary, and my first job was to empty coffee machines for coins. So I've been very fortunate, yes.
Coins?
Yes.
Like, why? Coffee was not free?
No.
Oh, okay. so you would get them. That was your first job in where?
In Leo.
Oh, Leo charged for the coffee.
Yeah.
Okay, so
for us
was it a vending machine?
Yeah, well, you know, for us it's very important that we use our resources where they matter the most, and that is to provide better solutions for patients, not free coffee.
Kasi parang lahat ng mga Pinoy parang, oh my God, pag walang libreng kape, lagot. Diba? Parang, I guess we're a bit spoiled in that sense, right? But, so Leo Pharma has been in the Philippines since when?
Ooh, that's a good question, but actually I think since the 1960s we've been here, and obviously Fucidin plays a major role in our history also in the Philippines.
Yeah, because I don't know of any other brand. I'm not, like, for us, right, parang automatic, whether you're in the dermatologist or you're in the pediatrician, they're going to say use Fucidin.
Yes.
So, diba, parang I think it has been part of, well, our first aid kit for so long.
Yeah.
Right, Doctora? Yes. Yung ano, because of, it's been here the longest. Could it be that, Doctora?
And of course, we should also consider also the efficiency that it gives.
Oh,
Yeah, most effective.
so let's call on because she's with Leo Pharma, to join us. Para she will enlighten us some more. Hello, Doctora. Okay, Doctora, you have to introduce yourself to everybody.
Testing. Good afternoon, everyone. I'm Dr. Gardiner. I'm the Medical Engagement Manager for Leo South Asia.
Again, you're the
Medical Engagement Manager for
What does
Leo
it
South
mean?
Asia.
Medical
Specifically
engagement.
for scientific and medical affair function. So aside from speaking to groups of people, different stakeholders about our products, I'm also in charge of training our field force both in South Asia and in the Philippines.
Wow, South Asia. So what countries?
Okay. So technically we have 12 countries in South Asia, but 4 are distributor markets. The ones I'm training, the niche markets are the Philippines, Malaysia, Thailand. Then we have Singapore, Hong Kong, Indonesia, Vietnam, and Sri Lanka.
Oh, and you yourself.
Yeah, Philippines.
And you've been with Leo for how long?
For 6 years already.
6 years. And prior to that, what are you doing?
I'm an OBGYN by training.
Oh,
Okay.
okay.
But I've been in the corporate for more than 7 years already, and I'm enjoying the job.
Why? But you practiced it.
Yes, I did practice. After I passed my diplomate exam, I went into the academe. I think I enjoy teaching. I found my niche
Wow.
in teaching and training. So it was a good opportunity to go into the pharmaceutical company, travel and teach at the same time.
Okay, so I have to ask you this. Okay, since parang when we were wondering about Fucidin and its efficacy. Okay, and first of all, why is it so much better to use Fucidin than anything that is those mga all natural or those mga herbal?
Okay, probably because if we're talking about the herbal or the natural things that we are not sure of the antibacterial property that it possesses. So if there is an infection, we do not know how deep or how effective it is in actually controlling infection. When it comes to Fucidin, fusidic acid or sodium fusidate, which is a generic name, it is a special antibiotic in a sense that it's a unique in its form. It has a deep penetrating effect because of its structure. So it's able to start working within 2 minutes upon application. Exactly that, in 30 minutes you find it in the deepest layers of the skin. So the management of the wound when it comes to infection is faster as compared to other antibacterials in the market.
How often should you apply?
Basically, for all the Fucidin products, we recommend about twice a day application, except of course...
Sorry, Doctor. I should have believed you.
It would depend on the severity of infection as well. So twice a day is probably a good minimum number of application per day.
And how much?
Okay, so Fucidin is...
And what should you use?
Okay.
Okay, finger ba? Or should it be a cotton swab or a Q-tip? What do you use?
To be specific, of course, if you really want to make sure that there's not going to be any other infection or any other bacteria that would live on that, the ideal thing is to use a cotton planchet as much as possible.
Oh, what? Sorry.
Cotton planchet,
Cotton bud.
So
Okay.
you do not directly touch the medication. However,
Okay.
for some people that might probably be not available readily, so as long as you wash your hands, you apply just a little bit on your fingertip and you apply it to the wound, then wash your hands immediately after, that would be good as well.
Why do you have to wash your hands immediately after using it and applying?
Okay, because technically we do not know if there is really bacteria in the skin and you might transfer it to other people as well. So
okay.
hand washing is really important before and after treatment.
I learned something new. Dead makakot sa after. I didn't know
If
that.
there's pus or blood or any fluid exudate coming out from the wound and you try to put on your medication, there might be something that will be left in your hand. And touching other things or other people might transfer the infection.
Were you doing that?
No.
Oh, so now we've learned we have to. Okay, so wash before, wash after. Okay, and twice a day.
At least twice a day, depending on the severity of the infection. So it's best to check or ask your doctor about it as well, because we want to capture or to treat completely the infection before you start medicating.
Mahal ba ang isang Fucidin?
Well, it depends on what you consider mahal.
Yeah, that's why.
Yeah.
Ano, para
So our cream and ointment is available in leading drugstores, priced at $347 per tube. So probably some people would think it might be too pricey, but when you're talking about good medical drugs for that matter, price would always equate with efficacy as well as the quality of the product. So if you factor in all the other complications that might set in if you do not adequately treat the infection, I don't think price would be a big matter for such extra sure moms.
And I don't think you have to use that much.
Yes.
Diba? Especially because it is an antibiotic, diba? Tama ako na you're not supposed to overuse.
Yes, because we have a big problem now of resistance, where
Yes.
antibacterials are not working as effectively as they used to before. So just a little bit, usually we recommend 5 to 7 days of using the antibacterial. Then stop.
Once you open the tube, it's good for how long?
Again, if you're going to be following the product insert, once you open, it is good for at least 2 to 3 months. Okay? Because you're exposing it to other bacteria in the environment. So,
I learned again.
Okay.
Okay, 2 to 3 months pala. And then so, even if like there's still half of it left, change.
Technically, yes, but
Yes.
you know, for some Filipinos, nagtitipid kasi tayo so we would want to prolong the life of the tube for that matter. But as long as probably you could make sure that you do not infect the tube, you use the right method of applying your medications, and you could prolong efficacy as well.
Doctor, explain to us the best way to heal. Should you put a band-aid after putting the Fucidin, or you just yung pahanginan yan para mas gumaling? Ano ba siya na totoo?
Okay, so better if you put bandage on it. Yeah, better if you put bandage on it.
So it's an old wives' tale na dapat pahanginan, wag
Well,
takluban.
it depends, no? Lalo na if your abrasion or your wound is very, very deep, better if you cover it. Why? Because the reason of infection as well, no? So it's the same thing. If you don't cover it, since you have an open wound, Staphylococcus aureus will get inside there. So better if you cover it.
Cover.
Yeah. On top,
How
of course,
often?
on top of your
Fucidin. But how
That's it.
often will you change the dressing?
Once a day will be fine. Once or twice a day. It depends. Like for example, if you underwent cesarean, your suture, you can have that change once a day.
Oh,
Yeah, once a day lang will be
So
fine.
you mean to tell me, pag nanganak, ang Fucidin ginagamit din?
Better.
Ah,
Yeah. Any type of wound will, that's
Doktora?
Any type of wound, be it a dirty wound, which means you got it from probably playing or you wounded yourself, or it could be a sterile wound wherein you got the wound inside the operating room. It would aid in healing. And you were asking a while ago how safe it is. It's pregnancy category B in the Philippines.
What does that
which
mean?
means that it is there are no reports of teratogenic effects or cancer or mutation effects in children. So you could use it safely among pregnant women at any trimester of pregnancy.
Oh, that's good to know. So it's safe. And you do recommend using it from 5 to 7 days.
At least 5 to 7 days, again depending on severity of the infection.
It's really, really severe, like you get cellulitis, the one I'm talking about. You should take that. You should also take oral antibiotics as well. And if it's really severe and it cannot be healed with your oral antibiotics, hospitalization is also warranted.
Okay,
So
so
that means that any simple wound, you don't have to be lax about it. You have to clean it and do proper wound hygiene.
in other words, parang yung wag dedmahin.
You're right.
Diba? Because you might pay a higher price by ignoring the wound, right? Correct?
Complications might set in. It might incur more expenses later on for the family or the patient as well.
Okay, so when, Doktora, kailan kaya ni Dr. Mom and kailan kailangan pumunta sa doctor na talaga?
Okay. So,